I'm here with Frank Wells of Holy City Med, Urgent and Primary Care. Frank is no stranger to the healthcare market. He's been an executive there for 13, 14 years. Prior to that, in the turnaround business, and also has a lot of acumen in the financial area. So we're here to talk to Frank about a little bit what he's doing in the new normal. Welcome.
Thank you. Appreciate it. Thanks for having me, Hunter.
I'm so glad that you could be here.
Good. Glad to. I didn't know I had acumen, so I'm excited.
Yes, you definitely had acumen.
That's good.
So what you got there?
It's our hand sanitizer. If you stop by the clinic, you can pick up one of these for any adult who asks while supplies last. So just a little travel one that keeps you clean when you go.
Right. So very COVID friendly.
Yes, very much so, yeah.
And we're also sitting the COVID friendly 6 feet apart.
Pretty close, yes.
Pretty close, right?
That's
okay.
right.
So speaking of COVID-19, which everyone is probably kind of tired of talking about, but it really made us step up our game in healthcare, didn't it?
It made us make a few changes earlier than we normally would have. One example is the video medical visits. So we just opened in January, and we knew we were going to add the video visits once we had a certain number of clients and employees in our plan, and pretty much after the first year. But we went ahead and did it. It really just took a couple hours to add the video medical visits to the plan, grabbed some URLs, and added the technology in the room with iPads. It's very simple to do. Our doctors love it because they can see the patient. It's not just a telephone visit like you might have a nurse visit over the phone. And so they actually get to see the patient. The only thing they don't get is blood pressure and the vitals, basic vitals. But they get all the chief complaints and the medicines and the allergies and the prior history and surgeries and everything on the patient. Really easy to do and so convenient for the patients who can't leave the house or don't want to leave the house, or they're compromised in some way, or they have illnesses that they're dealing with. And so incredibly convenient for them. It's been a blessing, and we offer it for free for folks that have lost their job or income during this time.
So talk to me a little bit about that. Holy City Med itself is an innovative concept in the market.
Right.
It isn't a traditional medical setup, which is not fee for service. So it's subscription or membership based, correct?
Yeah, that's right.
Tell us a little bit about that, and then I want to circle back around to the goodwill that you created with the virtual visits.
Yeah, so I was in the business with another urgent primary care here in town for 12 years. We were seeing 150,000 patient visits a year, 0 appointments, average wait time was 7 minutes. So we know how to move quickly, and really the secret is for everyone is hire lots of staff for every doctor or PA you have there. So we have 5 staff.
What's your formula?
We have 5 staff for every doctor or PA. Okay. So they're running around doing a whole bunch of stuff so that the doctor can really just focus on diagnosis, evaluation, and treatment of the patient. So it makes it incredibly efficient. So coming out of that model was we accepted over 600 insurance plans. We figured out that half of the cost of providing medical services was in the insurance acceptance. The credentialing, the contracting, the filing, the people sitting in a room in front of a computer, then trying to collect, and then trying to defend against audits because the insurance company wanted money back.
It is so layered, isn't it? I mean, all of the things you have to do to be compliant.
Yeah, it is. So we decided that we tested the model with Renew Medical downtown on King Street. The self-pay model over the last 4 years works great. And so with Holy City Med, we are a self-pay or direct pay model. We're kind of under the scope of direct primary care, but we also do urgent care. And so if cough, cold, congestion, you hurt yourself, you need an x-ray, all that stuff's included in our visits. So you don't have to go pay for a primary care visit and then stop and go pay for an urgent care visit. We do it all in one.
Okay, so let's take that. Now we know what model you are.
Right.
Now we know how you're providing care to your community. So during COVID, a little birdie told me that you were doing virtual visits for free to the community, to people who'd lost their jobs.
Right.
So I just love the goodwill that must have created for you. But where did that idea come from?
So some of the restaurant owners that are friends of mine, they grew up here in town, and some of them having to lay off 900 workers, another one having to lay off 200 workers. And we thought, we just built this big, beautiful building. We've got capacity. Why not? And so selfishly, I get to keep my staff busy with seeing patients, and unselfishly, I get to offer something because we have capacity to the community where they can just get a video medical visit for free. You know, if you've got diabetes and you don't want to go to the hospital because they're treating COVID there, it's not okay for you to just run out of your meds and be without them. So diabetes and hypertension and high cholesterol. And so we're glad to, help people get a refill, another prescription on those meds during this time. Our big focus is on individuals, walk-ins, and then through companies, through small businesses and medium-sized businesses to keep their employees healthy. But I'm glad to use that as a resource. We have it, why not? So.
And a note to those of you who may be listening or viewing, since Frank is a actual subscription or membership model, he isn't really going to have to ride the roller coaster of the reimbursement of virtual telehealth. Right. So we know that you are, many of you that are in the fee-for-service, and that's something to factor in. However, I feel like, and do you agree, that virtual visits are here to stay?
I think so. Yeah, they were very small acceptance. I think MUSC, Dr. Ed O'Brien, about 3 years ago, I think maybe next month, started the virtual visits at MUSC, and very low adoption at first, and now it's huge. Now everybody has virtual visits or video. We like to call it video medical visits because telehealth might be on the phone. We sort of start on the phone. They call 843 Holy City, take all the information, and then the part of the visit that is video is with the doctor or PA that does the evaluation. So yeah, I think they're here to stay for a certain percentage of the population. Obviously, we can't draw blood or shoot an X-ray or give injections or
right.
do labs over video, not yet.
Oh, wow.
But one of the biggest innovations, I think, other than video's been around for a while, but the biggest innovation is something we laughed about 6 years ago.
What's that?
We said, let's do drive-through medicine. And it was sort of a joke. But now, so we don't really do drive-through medicine, we do drive-through testing. So people will come through their drive-through and do the COVID test in their car, because the safest place for them to be and not expose the infection to other people is in that capsule, if you will. Roll down the window. My staff are in the PPE, the proper PPE for that, and they'll do the test right in the drive-through.
So how easy or difficult was that to implement?
It was super easy. I mean, if you have the location, so for us, we're standalone locations, clinics.
Okay.
If you're in a in a mall or in a strip center, I imagine it would be very challenging to try to figure out how to maneuver.
Like MUSC's was in the
right.
Citadel Mall area.
That's right. Well, they took a whole parking lot to do that, so
right.
I could use my parking lot to do that. It was super easy. So it's kind of like a Chick-fil-A. Remember, Chick-fil-A had a drive-through, but then when they realized so many people use it, they added the covering. So we're actually adding a covering to our drive-through, less for the patients and more for our staff. Because when they're under the hot sun or if it's raining, we want them to have cover while they're doing the drive-through testing. And then we added, so you can come through and do a flu test for $20. Never get out of your car. If you have the flu,
not just the COVID test.
Not just the COVID test.
We added
other testing through the drive-through that people could do very affordably. You don't have to pay for a doctor's visit. Normally, when you get a test, most of the other clinics around us charge you about $125 for the doctor visit, and all the patient really needs is a test. So we added our COVID test is $80. Even the reimbursement through Medicare is higher than that. So we just found a really great deal through a lab. We negotiated the price, and it's the FDA approved lab that we use, tests that we use. So it's very accurate and affordable. And then we added the other testing. You can get a flu test, a strep test, you can get your A1C and your blood sugars checked in the drive-through, which is so cool.
That is cool. And you strike me as entrepreneurial. So people who are typically innovative and entrepreneurial can actually adopt these types of new ways to deliver care quickly.
Right.
But I find in healthcare that quickly isn't always the case. But coronavirus really made us have to do things rapidly.
Right.
And it's curious to me that we were able to do them so rapidly, so efficiently, and that it may have actually changed the face of how we deliver healthcare.
Right.
For you specifically, what are the things that you adopted during the COVID phase that you really feel like are going to change the way you deliver healthcare in the current and future state?
Right. Mostly those two. It's the video medical visit that's more prevalent now, and then the drive-through medicine or drive-through testing. Even in our location we're building right now, 526 and North Rhett, we've gone back to the construction guys and added a physical drive-through to that location too. We'll do that for each subsequent location here in the Low Country, and then throughout the state when we grow there.
Move over, Chick-fil-A.
That's right. But no fries.
But no fries.
No fries.
No
in
fries
the
with
drive-thru.
that.
That's right.
I see. Well, and for me, when I was looking at Holy City and watching you move the little cones around and everything else, it looked fairly easy to implement.
Right.
Did you, for the video piece, feel like that was easy to implement and easy to keep as well? Or has that been a little more complicated?
No, incredibly easy. We were going to do it anyway. It just moved up the timeline to implement it, and it was very simple.
Okay.
Again, and back to the drive-through testing, logistically easy for us because we're a standalone location and no other building is right around us or right on Savannah Highway at 526. So we right on the road, but we have plenty of parking around us to be able to manage and create the drive-through in front of our clinic, in front of our front doors.
So you're a native Charlestonian,
Yes.
correct? Pork out.
Yes. Born in Roper Hospital.
Born at Roper Hospital. Okay. So giving back to the community is something that I would imagine is important to you. On a long-range view, creating community goodwill on an ongoing basis and being there for these businesses that you are actually providing health care, how does your model of healthcare delivery system allow you to really establish good community?
Right, yeah. Well, it starts internally with our staff, so treating people well. We have profit sharing. We do 12-hour shifts, so I buy them lunch every day, matching retirement plan. We have gift cards that we buy from Walmart and have available for them to hand out if somebody comes in and they may have a challenge filling their cupboard with food or staff.
Wow.
And so we kind of do that internally, but then externally is the way that we offer medicine. I think being a manager, a business owner, a steward of other people's lives in the workplace is such a great privilege and opportunity. And so our goal is to help them. So if it's so expensive now to have health insurance, but great when you go to the hospital, but you can also buy catastrophic hospital coverage that covers that portion of it for about a third of that cost. And then the preventive care that most people have to pay out of their pocket, even though they're insured. Because 1 out of 20 people who are insured meet their deductible. The other 19 out of 20 people never meet their deductible. So when they go to the doctor, they pay $200 or $250 for a visit, so they don't go.
Right.
So our point was, let's make it incredibly affordable. I know a high volume system. I did it before at the last company where we sold a year and a half ago to a company outside of the state. And they changed a bunch of things. And so interesting, they changed a bunch of things that we implemented. And so I could do it without being a conflict with them. And be able to offer that to employers at a rate that's $37 a month for unlimited medical visits. And it's,
Wait a minute. What?
So
Say it again.
So it's $37 a month, unlimited medical visits, and the real key is it includes the EKG and the X-rays and the in-house labs and the testing and the shots and the flu and strep. All that's included. Where normally you go and you pay a fee, and then you show up at the doctor and they're like, "Oh, I need an X-ray." Well, that's $80. Oh, I need an EKG. That's $100. We just knocked all that out. Primarily, we're able to do that because we got rid of the insurance plans. We don't have to file and do claims and have people sitting in a room filing all these things. People walk in the door, they can pay us $97 and be a walk-in and get all that stuff and walk out the door, and that's it, they're done. So when we don't have expenses in following up with people and filing claims and mailing statements and invoicing, we pass that savings on to every one of the patients that comes and sees us.
Is it primarily your reduced FTE count that allows you to do that, or is it
Well, it's that and expense. It's less people, right? Less labor in processing claims.
Okay.
Because someone walks in the door, and a company pays us $37 for the month, and that employee can come as often as they like and get testing. And really the key is to have preventive care. So if you're really going to take care of your employees, you don't want them to end up in the hospital. That's where it gets really expensive, right? We love the hospitals there because they have all that stuff and robotics and all the imaging and stuff that they can do there. But you want to prevent that expense, and that's through prevention. So if you're 11% of our workforce is diabetic, type 2 diabetic, and so they need a certain amount of visits to check their sugars and check their current sugars and their A1C, which goes back 90 days and looks at where your fluctuations are to try to help people be more compliant. Hypertension and heart disease and high cholesterol and all those things need preventive visits. We just said, look, it's not $250 anymore. It's $37 a month, come as often as you want. So we're actually looking to drive up the frequency of doctor visits.
So I can come see you every day?
You could, but we know you won't.
Right.
But if you come every quarter, you can. Yeah, absolutely you can. But if you come every quarter, or at least every 6 months, it's more than the national average.
Yes.
The national average is under 2 visits a year, and we actually want people to come see us 4 times a year as a nice rhythm. You get to know the doctor, and they'll do it if it's super fast and affordable, and if the quality is very high. Our doctors and PAs are all ER trained. They're great at urgent primary care because when they look at you, they start at the worst that can happen, which is their ER eyes. And then once they realize that you don't have meningitis, you don't have you're not going to die of a PE right now or heart attack.
What a relief.
Yeah, then they can treat your normal symptoms. And then if it's just cough, cold, congestion, that's easy for them because you're not dying.
Right.
And they take care and address the symptoms. And we built our system around the fact that they can do that very efficiently with enough staff around them, the in-house testing, the x-ray. And if we have to send out to a specialist, we've also created a direct specialty network that has great discounted self-pay pricing for their services.
If they come as part of the Holy City Med.
Well, we've just negotiated with our referral specialists here in town to say, please offer us a great self-pay price. And so there's a imaging center that'll do a CT for $260.
Right.
And if you go to an expensive place like the hospital, that's $700, $800, $900 or more for the same test. So it helps people out. And if you're not going to hit your deductible, it's all out of your pocket anyway. So those 19 out of 20 people that have never meet their deductible every year, they're not going to the doctor because they don't want to spend or maybe don't have that extra $250 to pay for a cough.
Well, I love how you are helping us to improve our health status here in Charleston. And we'll be looking to see how the Holy City Med model does in the future state.
Great.
Thank you for joining us.
Thank you so much. Appreciate the question.